name is Ben Holloway. I'm a primary care physician in Greene, and I attend Canton Nazarene. The cases of COVID-19 are rising throughout our country, including in Ohio. This is a very serious situation. It is true that some people with the virus have no symptoms or just mild symptoms. It is also true that some people die from the virus. I'm concerned about the health and safety of our congregation. Now is not the time to be lax about taking precautions to help protect ourselves and each other. And if we don't more vigilantly take precautions that we've been advised to take, I believe it's only a matter of time that we could have an outbreak of COVID-19 at our church. That could result not only in some of our congregation severely suffering or dying unnecessarily, but it could lead to the health department closing our doors to in-person services for a period of time. Governor DeWine is urging every Ohioan to be vigilant about taking the necessary precautions, keeping 6 feet apart in public areas, wearing masks in public places, washing hands, and staying at home if you're sick. The virus that causes COVID-19 spreads primarily through droplets. In normal conversation, droplets in a person's lungs can travel 3 to 4 feet. For an uncovered cough, droplets can travel up to 12 feet. When someone is singing, droplets can travel up to 12 to 15 feet. That is why I personally keep my mask on while singing in church, as unpleasant as it may be. It is extremely important to keep at least 6 feet apart from others that are not in your same household. This is particularly important when you're having a conversation with somebody or sitting in a small group or worship service. The smaller the enclosed space and the closer together people are, and the longer they're together, the more the virus can spread. Outdoors is the lowest risk environment where there is fresh air that is not recirculating.
Hi, I'm Andy Hansen, and I am the middle school director here at Canton Nazarene. I'm also a medical social worker at Mercy Medical Center. And I just want to thank Dr. Ben for coming in and just sharing his thoughts, giving us some information, and really sharing his heart with us for our church and our church family. So just in review, Dr. Ben mentioned the importance of wearing masks. He mentioned the importance of washing hands, and he mentioned the importance of social distancing. I know it's so hard when we get here on Sunday mornings to keep all of those things in mind because we're excited to see people that we love that we haven't seen maybe in a week or longer. But really we have to just remember that we're doing this out of love for one another. And all of these things that we're talking about them because really as a church staff, as a leadership team, as an organization, we love you. Dan and I, we love you. And our heart is to not have to walk through a tragedy with you, although we would gladly do it. So as we walk through this together, it's so important just to remain flexible. Things can change as new information comes out. Remain flexible. Continue to have conversations with each other, with your church leaders, with your church staff, and just walk through this together as a church family who loves one another. Thank you for your time and your attention. I hope you all have a great week.